Senator Casey.
Chair Murray, thank you very much. I have a question for Dr. Levine and one for Dr. Murthy. I'll start with Dr. Levine. Two issues relating to children. One is mental health and the other is child abuse. 1 in 5 children have, before the pandemic, suffered from mental health issues, and rates of anxiety and depression have doubled since the pandemic. It's hard to comprehend the scale of that. In fact, mental health issues now account for 30% of emergency room visits for high school and middle school students. 30% of emergency room visits. Over half of young adults report symptoms of anxiety and depression. That's mental health. Then we go to the horror, the American scourge of child abuse. Frankly, that neither party has done enough to combat. Child abuse is on the rise, we know that, and yet without the contact provided through in-person school, many more cases are going undetected. With all of these terrible stressors that are burdening our children, it's more important than ever that we focus on children's health and behavioral health needs. Dr. Levine, given the depth of your experience in addressing quality and access to mental health services, can we be assured that these issues will be priorities for you if you're confirmed to this position at HHS?
Well, Senator, thank you very much for this question. And I would like to thank you so much, you and your staff, for all of your work on these very important issues. I am a pediatrician in my original field, and I still have a pediatrician's love for children and adolescents, and will do everything possible to work for the betterment of children and adolescents in our country. Mental health, as I mentioned in my opening statements, has been really that intersection between medical issues and mental health issues has been really one of the bases of my career. And I look forward to bringing that experience that I have in academic medicine and at the Penn State and the Pennsylvania Department of Health to my role if I am confirmed as the Assistant Secretary of Health. And I would very much like to look forward to working with you and your office and your staff, since I know that you have done a lot of work in this area.
Dr. Levine, thank you. Dr. Murthy, I have a question for you based upon your work combating vaccine hesitancy and the culture of prevention you've often spoken of to reduce the burden of preventable illnesses related to diet or exercise or isolation or vaccine preventable disease. To your credit, you've worked with others on these goals, reaching out to employers, faith-based leaders, even partnering, as Chair Murray mentioned, Elmo on Sesame Street to better reach families. When you co-chaired the Coronavirus Advisory Team, you collaborated with Dr. Marcella Nunez-Smith, who is now leading the COVID-19 Equity Task Force, working to reduce disparities related to the pandemic and assure equitable allocation of resources, including the vaccine. We're now fortunate enough to see a light at the end of this terrible dark tunnel we've been in. The vaccines are helping us prevent disease and death. If we have all the information we need and trust so that more of us will make the decision to take the vaccine when it's our turn, if that happens in greater numbers, we'll all be in better shape. As Surgeon General, how will you use your leadership and the full force of the Public Health Service to address this issue of vaccine hesitancy so the people of our country can establish the trust they need to take the vaccine?
Well, Senator, thank you for raising this important issue. You know, I think we have seen concerning rates of vaccine hesitancy when it comes to the COVID-19 vaccine. And what I would seek to do if I had the privilege of serving is, number one, seek to understand directly by listening to people, by showing up where they are, what's driving their concerns. And it's different. I think we can't assume that the same issues are concerns for everyone. We can't assume there's also one-size-fits-all solution to vaccine hesitancy. We got to understand what people's concerns are, and then we have to bring the best of science to address those questions the best we can. But Senator, I also think that we've got to do this in partnership with local communities. I learned from my past experience as Surgeon General that one has to approach the task of communication with humility, recognizing there's a lot we do not understand, and that people on the ground, faith leaders and educators and doctors and nurses often know far more about what their communities need and what their concerns are. So we've got to listen with them, work with them, and together I do believe that we can help reduce rates of vaccine hesitancy.
Thank you. Thank you, Chair Murray.
Thank you very much. Senator Paul.
Genital mutilation has been nearly universally condemned. Genital mutilation has been condemned by the WHO, the United Nations Children's Fund, the United Nations Population Fund. According to the WHO, genital mutilation is recognized internationally as a violation of human rights. Genital mutilation is considered particularly egregious because, as the WHO notes, it is nearly always carried out on minors and is a violation of the rights of children. Most genital mutilation is not typically performed by force, but as WHO notes, that by social convention, social norm, the social pressure to conform, to do what others do and have been doing, as well as the need to be accepted socially and the fear of being rejected by the community. American culture is now normalizing the idea that minors can be given hormones to prevent their biological development of their secondary sexual characteristics. Dr. Levine, you have supported both allowing minors to be given hormone blockers to prevent them from going through puberty, as well as surgical destruction of a minor's genitalia. Like surgical mutilation, hormonal interruption of puberty can permanently alter and prevent secondary sexual characteristics. The American College of Pediatricians reports that 80 to 95% of prepubertal children with gender dysphoria will experience resolution by late adolescence if not exposed to medical intervention and social affirmation. Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Well, Senator, thank you for your interest in this question. Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I would look forward to working with you and your office and coming to your office and discussing the particulars of the standards of care for transgender medicine.
The specific question was about minors. Let's be a little more specific since you evaded the question. Do you support the government intervening to override the parent's consent to give a child puberty blockers, cross-sex hormones, and/or amputation surgery of breasts and genitalia? You have said that you're willing to accelerate the protocols for street kids. I'm alarmed that poor kids with no parents who are homeless and distraught, you would just go through this and allow that to happen to a minor. I would hope that you would have compassion for Kira Bell, who's a 23-year-old girl who was confused with her identity. At 14, she read on the internet about something about transsexual. She thought, well, maybe that's what I am. She ended up getting these puberty blockers, cross-sex hormones. She had her breasts amputated. But here's what ultimately she says now. And this is a very insightful decision from someone who made a mistake but was led to believe this was a good thing by the medical community. I made a brash decision as a teenager, as a lot of teenagers do, trying to find confidence and happiness, except now the rest of my life will be negatively affected, she said, adding that the medicalized gender transitioning was a very temporary, superficial fix for a very complex identity issue. What I'm alarmed at is that you're not willing to say absolutely minors shouldn't be making decisions to amputate their breast or to amputate their genitalia. For most of our history, we believe that minors don't have full rights and the parents need to be involved. So I'm alarmed that you won't say with certainty that minors should not have the ability to make the decision to take hormones that will affect them for the rest of their life. Will you make a more firm decision on whether or not minors should be involved in these decisions?
Senator, transgender medicine is a very complex and nuanced field, and if confirmed to the position of Assistant Secretary of Health, I would certainly be pleased to come to your office and talk with you and your staff about the standards of care and the complexity of this field.
Let it go into the record that the witness refused to answer the question. The question is a very specific one. Should minors be making these momentous decisions? For most of the history of medicine, we wouldn't let you have a cut sewn up in the ER, but you're willing to let a minor take things that prevent their puberty, and you think they get that back? You give a woman testosterone enough that she grows a beard, you think she's going to go back looking like a woman when you stop the testosterone? You have permanently changed them. Infertility is another problem. None of these drugs have been approved for this. They're all being used off-label. I find it ironic that the left that went nuts over hydroxychloroquine being used possibly for COVID are not alarmed that these hormones are being used off-label. There's no long-term studies. We don't know what happens to them. We do know that there are dozens and dozens of people who've been through this who regret that this happened and a permanent change happened to them. And, you know, if you've ever been around children, 14-year-olds can't make this decision. In the gender dysphoria clinic in England, 10% of the kids are between the ages of 3 and 10. We should be outraged that someone's talking to a 3-year-old about changing their sex. I can't vote for you if you can't make a decision.
Thank you so much, Senator Paul. Senator Levine, thank you for answering the question. I will turn to Senator Baldwin.
Thank you, Chair Murray. And I want to welcome Dr. Murthy and Dr. Levine to the Help Committee. It's good to see both of you again. I want to turn our attention, perhaps not turn our attention, we've sort of been speaking about this already, but to the issue of health disparities, which I know both of you have worked to address throughout your careers. Back when I served in the House of Representatives on the Energy and Commerce Committee, we had a series of hearings on health disparities. These hearings were shocking and perhaps part of the early stages of us as a Congress trying to tackle health disparities that exist. And I'm recalling in multiple hearings where we would have a panel of expert witnesses talking about the health disparities that exist, talking about possible ways to diminish these